major depressive disorder, many of them have trouble getting out of bed in the morning, whether or not they're an addict. And so if you sometimes there's a gray area where you can't really tell whether the depression predated the addiction and problems with substances or not. And in those sorts of cases, you know, as a clinician, I want to be very careful about treating people because I don't want to over-treat people that don't need to be treated. But if I can make a clear case in my mind that the depression preceded their substance use and they've had problems with this before, to not treat them is to say that I'm willing to accept an increased risk of their relapse, because people who are depressed cannot do the work that's necessary to get and stay in early recovery. It's just not possible. And so it's like saying, well, I want you to do okay, but I'm going to break your leg and not give you any crutches. You know, it's like, it may be what, and I agree with Dr. Hunter, like working a recovery program very often means that people don't need antidepressants later. But if they have major depression by criteria, they are not going to be able to do the work that we want them to do here, and they're not going to be able to do the work that they need to do when they get out of here to stay clean.
Just one other comment is the treatment, of course, would be antidepressant medication if we diagnose major depressive disorder. So that would be an obvious difference. But the recovery program itself, I mean, the fourth step, it said, Bill Wilson from Alcoholics Anonymous, the founder of Alcoholics Anonymous, was profoundly depressed. He suffered from major depressive disorder, and actually working a fourth step is one of the treatment modalities that really works on that core shame and you know, the issues that underlie depression. But it's really important to know that certain people who have a biochemical abnormality, the way Joan talked about, they simply can't respond. I mean, they can't get out of bed because they can't get out of bed because they have this biochemical deficiency of either serotonin or dopamine, and that without medication, they're not going to have a chance of doing a first step, let alone a fourth step. So, and it's tricky because you don't want to overdiagnose. I mean, I think we're all going to say the same thing over and over, and it comes up in our treatment teams and in our philosophical discussions. We don't want to overtreat, but if we undertreat, we're going to miss and we're going to stimulate a relapse.